Today, I'm going to give you an update about the direct contracting entity, which was almost a crisis under original Medicare and how it affects you. And then some recent good news. Something has changed because you reached out to your members of Congress. We were the first ones to bring you this information on this platform here known as YouTube and the underworld that is sharing truth and good messages throughout the interwebs. I want to share with you what your actions have accomplished here. 40 members of Congress reached out to CMS and told them that this direct contracting entity, which if you're not familiar, this is a program where it started as an experiment and it was trying to bring those 60+% of people that are on original Medicare, that's your red, white, and blue card, go to any doctor in the country, no networks, no restrictions. It's what you paid into your entire working life. Well, industry wanted to try to get those people and pull them out of original Medicare and put them into a hybrid program where you can manage the care. And the savings that are accomplished by managing your care, which means giving you less care, they take those savings and take it into profit. Similar to what happens with the Medicare Advantage world, where the government pays an insurance company directly all and even more than they would have paid on original Medicare, so that they can take you off of the rolls of original Medicare and have your health care managed by an HMO, where they dictate what referrals are required, what prior authorization permission is required before you have any expensive test or treatment. So that difference there, the difference in what they save by managing your care, is what's known as profit to an insurance company. So the insurance industry has been trying for a long time to figure out how can we accelerate those people in original Medicare to come over into the managed care world so they can manage them. One such program was called the Direct Contracting Entity Program, where Medicare would contract with independent physicians not owned by an HMO yet, and without you even knowing about it, depending on, well, the geo contracting model was the first one, and that's where, depending on where you live, you could be thrust into this managed care organization without you even knowing it. That program was halted. Then there's a direct contracting entity where the government would contract directly with a group of physicians or hospitals, and then if you happen to be going to those doctors or hospitals, they could just suck you into the program, and really without you knowing it, except for one notification letter that you were supposed to get, you would have your care managed within the network, referring you only within the network, and wherever they could save money, they would save money, because the incentive, again, is the less money spent on healthcare, the more profit made to the organization. Well, we raised all kinds of fire on the internet about this, and a lot of people came and copied our video afterwards, which is great. I'm glad we got the word out there. And again, 40 members of Congress approached CMS, that's the Center for Medicare and Medicaid Services, and told them this just won't fly under the new administration. So some good things have happened. I want to give you an update on what's going on here. So this is the update from CMS directly. And they, of course, they always insert politics into this. They always take credit and put blame, even though it's coming through an administrator like CMS. And it says here, building on the Biden-Harris administration priorities for blah, 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 better healthcare system. I'm going to go down to the part that's actually important right here. As CMS works to achieve the vision outlined for the next decade of Innovation Center, the Innovation Center is where they had this program going as an experiment. CMS wants to work with partners who share its vision and values for improving blah, blah, blah. Let's see. Here we go. First, this is the changes with it. Any model that CMS tests within traditional Medicare must ensure that beneficiaries retain all rights that are afforded to them, including freedom of choice of all Medicare enrolled providers and suppliers. This is one stark difference that many agents, most agents actually, that focus just on enrolling seniors in Medicare Advantage just won't tell you. And that's the fact that when you leave traditional Medicare, you don't have all the freedom of choice to go to any Medicare enrolled provider. And if you don't believe me, look right here in this statement from CMS. This is again addressing people in original Medicare. And it says that any program that they're trying to test needs to stay within traditional Medicare, which means it must ensure that beneficiaries retain all rights that are afforded to them under original Medicare. Most seniors don't even understand that when you go to a managed care program that's Medicare Advantage, HMO, PPO, and you're going into that program where they're going to manage your care, how they achieve the cost savings is because they are restricting and limiting your care. That's how the profit happens. That's the margin. That's the difference. And so here, the biggest concern that people were having was they're going to be put into a managed care program. That's what all the pushback was from all these 40 congressional leaders saying, don't leave our Medicare or traditional Medicare and push it into managed care. People want what they paid for, dadgummit. So I think this is really a good change. We'll talk about the difference a little bit between direct contracting entities and ACOs, which is accountable care organization. And that's what this has changed into. So they're going to do away with the DCE model at the end of 2022, still going for now. If you're already in one, you're still in one. And they're going to turn this into the ACO REACH model, which is going to be an accountable care organization where they're going to monitor the outcomes of different experimental tests, pretty much putting you with a physician's organization, with an organization that has specialists within it, that they have referral relationships within those organizations. However, you can, and this is the biggest takeaway, you can opt out of this at any time. You're going to get a letter if your primary care doctor is a part of an ACO. Many of our clients have written to us since we put out the DCE notice, and they've told us, I got this letter that says I'm part of an accountable care organization. What does this mean? It just means they're monitoring your outcomes. What you need to be aware of, however, two different things. First, there's a big incentive in these managed care organizations, and you've seen them over the years. We can put some highlights on here. We've covered it every time. Whistleblowers within these organizations have been reporting to the Department of Justice, and to the chagrin of many insurance companies who paid hundreds of millions of dollars in fines as a result of these people being whistleblowers. What they've discovered is these organizations will try to upcode the diagnosis on their patients. They'll try to go back to Medicare and saying, we're losing all this money because these people are sicker than you first told us that they would be, representing the average sum total of the people who are out there in the Medicare world. So if I, as insurance company X, am getting all these sick people, it's going to, of course, cost me so much more money to administer healthcare to these people, and you, Medicare, need to pay me a lot more. Well, that's a big problem, because it's criminal, actually, to upcode people and to send to Medicare a bill for things that are tragically worse than they really are. Where this has really come home to roost is we've had a couple of people over the last couple of months who've contacted us and said, look, I'm trying to get off of Medicare Advantage. I'm trying to get off of managed care. And the problem that I'm having is this record shows up in my medical records saying that I've got things like COPD, congestive heart failure, things that are not attributable to me. The doctor never told me about it. I don't take any drugs pertaining to that kind of a diagnosis. Why are they saying that I have this kind of a disease? I'll tell you why. Because if you're on a managed care organization and they're upcoding you and giving you a diagnosis, they can charge more to Medicare every month, per member per month, and sometimes as high as 60% more for your care coming from Medicare. So you might want to look at your medical records and the diagnoses that are part of your records, especially if you've been on any managed care program, an HMO. How does that affect you? It affects you if you're ever trying to go back to original Medicare. That's fine, but get in Medicare and supplement insurance. Medicare supplement insurance always has the right to underwrite you in most all states. They'll take anyone brand new to Medicare during your open enrollment period. After that, in most all states, you have to be underwritten, which means they can ask you health questions and means they can pull your health information from the computer databases out there that will list all your diagnoses that you have. Also, if you're applying for life insurance, we're helping a lot of people now. I guess it's because of the coronavirus and everything else that's been happening in the last few years. They're wanting to now secure their financial legacy for their loved ones. So we're helping with larger and larger life insurance cases with our Medicare clients. And what comes up is the MIB, the Medical Information Bureau, will have a trigger on your account. And it's just part of life where they know everything about everybody. But when they know something that's not true about you, that's when you really need to be concerned. And what I mean by that is, if they have something in your record that shows that you have congestive heart failure, that's a problem. It's a real big problem if it never was you. And you may be the victim yourself of upcoding. Well, on a massive scale, that's massive fraud. On an individual basis, that might prevent you from getting life insurance or prevent you from getting a better upgrade to a Medicare supplement plan. And the supplement, of course, supplements original Medicare. So when you come off of Medicare Advantage, you come off of a managed care program, and you're trying to get into a Medicare supplement now, if you've got this record, as many of our clients are finding, you have to fight with the Medical Information Bureau, fight with these information providers to get that information off of your record because it wasn't accurate to begin with. So back to the changes with the ACO model, I'll just tell you that this is an article from Modern Healthcare, which is a paid subscription that I have. And I want to go to the second page here where it talks about the difference and what this is going to do. And right here, I'll zoom in so you can see it a little bit better. And there are a whole bunch of progressive Democrats actually that are fighting to keep original Medicare here, which is nice. And it says, but some who oppose the direct contracting entities want to see further changes. Representative says that she led dozens of lawmakers in a letter last month urging CMS to end the program, says CMS should do more to protect traditional Medicare. Yeah, I agree. And I want to go to this statement that's on the last page of this release here. And she says, while I'm glad to see the administration is taking steps to redesign this flawed program, I'm disappointed that these changes will not be enacted for 10 months and that there are no limits on how many seniors are funneled into this experimental model. More needs to be done, and I will continue to fight tooth and nail against any and all efforts to privatize Medicare. Well, good for you. And I'll just tell you that the risk adjustment program, which is the upcoding part, was actually addressed in this, which is a good thing. They know that this is a problem. It's a potential for fraud, primarily seen within the Medicare Advantage world, but they're concerned about it. They're actually calling it out in this revision where they're doing away with the direct contracting entity, at least by title, and then classifying it under the Accountable Care Organization, which has more scrutiny. And here's the part right here. CMS additionally plans to keep ensuring that scores across the model don't increase faster than scores for traditional Medicare. Coding intensity growth, that's a nice way of saying fraud. Coding intensity growth is a major concern in the Medicare Advantage program. Why is that? If they call it coding intensity growth, and it's a concern, I wonder why. The model could give CMS more information about how to limit coding intensity growth in Medicare Advantage in the future. And why would that be? What they're saying there is if they have information from original Medicare, traditional Medicare, where people can get any service that they need, any time that they need it, which is traditional Medicare. And in our world, that means a Medicare supplement with original Medicare, which means you can get service from anywhere in the country and you don't have to worry about an unlimited out-of-pocket expense. The Medicare supplement actually prevents you from having unlimited expenses with original Medicare. That's what the supplement is for. Then you don't have to worry in that world about, well, you're going to get real data, first of all, and you can take that real data and then look at the Medicare Advantage world and wonder why, as the Office of Inspector General did, saying, why is it that on Medicare Advantage, you have all these much sicker people? You take 1,000 people as a general sample of original Medicare, 1,000 people in Medicare Advantage, and the Medicare Advantage people seem to be much, much sicker on paper. Why is that? Well, now they're saying that they'll have an actual benchmark when they look at, which they've had already, the benchmark looking at healthy people or average people on this model where they're accountable for their care, and then compare that to Medicare Advantage. And I think the disparity will become even more clear as they're actually looking at the upcoding in general of the entire Medicare Advantage industry. And you'll see how much fraud there actually is. I think they've just uncovered the bare tip of the iceberg. So if you're going to ever go to Medicare supplement instead of Medicare Advantage, again, as I mentioned, in your initial election period, when you're brand new to Medicare, there are no health questions. You can get a Medicare supplement and you can sign up for it 6 months before you're eligible for Medicare, and that's called your open enrollment period, up to 6 months after your Part B of Medicare started. Many agents will write me all the time, and we have another channel and another business called MedicareAgentTraining.com, where we train thousands of agents around the country to do what we do, and that's to help seniors with Medicare. And many agents will always write to me and saying, wait a minute, I was told by my agency that you can only sign up for Medicare supplement plan 3 months after you're on Medicare. And the reason for that is, I don't want to get too much in the weeds as to how our industry works behind the scenes, but 90% of agencies out there are only training agents on Medicare Advantage. It's a very sad but true fact. They're only training agents to show you Medicare Advantage plans. Zero premium, Joe Namath, all these stars. Everything's included for free. It's a free Medicare Advantage plan. That's all the new agents are being trained in. They don't even know, so how can they then educate you, the senior? They don't even know that you can keep original Medicare, which is great insurance, except for one thing. You're responsible for 20% of the cost when you're doing all outpatient things, which most everything is outpatient, with no limit on that. So what do you do to cover that 20% of the cost while still keeping the freedom and the greatness of original Medicare that you've paid into all your life? You get a Medicare supplement, and it supplements the holes in Medicare. That's why many people call it the Medigap plan. So the point is this: if your agent doesn't know that you can sign up for a Medicare supplement even 6 months after your Part B starts, or even better, if you've been working a full-time job and you've been working at an employer with 20 or more employees, then that can extend the time period where you can start for a Medicare supplement plan even further through your open enrollment. That's your initial election period, where the world is your oyster. You can get any Medicare supplement that you want because you're traditionally brand new into Medicare. So again, most agents don't even know that. But if you're in that position where you're 6 months before, up to 6 months after you started on Medicare, or let's say you're 69, 70 years old, and now you're considering starting on Part B of Medicare, you're just thinking about it. We help people with that every single day to look at, should you continue on your employer plan? Should you keep on your retirement plan that they're offering? Is that even qualified coverage to exempt you? I want to show you something that's even better news. And this comes from the Medicare Watch. Let's see, the Medicare Rights Center. Can I add that? There we go. This has been a long time coming. Actually, this was originally proposed and passed in the House, but never got anywhere further than that. Now, I'll just read you the article real quick. It says, the Medicare Rights Center applauds recent introduction of the beneficiary enrollment notification and eligibility simplification. I always have these long acronyms in Congress. In the U.S. Senate, led by Senators Bob Casey, Democrat, and Todd Young, Republican, this important bill would require the federal government to provide advance notice, thank God, finally, to people approaching Medicare eligibility about basic Medicare enrollment rules, filling a longstanding gap in outreach and education. Not a week goes by that we don't have somebody calling in here and saying, should I have gotten Medicare when I turned 65? I forgot to sign up for it. Nobody told me I needed to sign up for it. Well, if you're not drawing Social Security by the time you're 65, then you're not going to be automatically enrolled in Part A. And they're not going to send you a Medicare card letting you know that you're eligible for Part B and all that. Why is that? They think in the government right now that as you're approaching 65, you should just know that you're eligible for Medicare and the ramifications for not signing up for it. There was a recent case, it was all over the news, about a lady who left her employer plan and still did not sign up for Medicare because she didn't know that she had to. And so now she had to pay for all of her cancer costs, all of it, until the next general enrollment period for Medicare, which is the following year. So that entire year, she had no coverage whatsoever. And the reason why, she just didn't know. So what this bill hopes to achieve is finally, and of course this is going to cost the government money because it's in your favor and not in theirs. Again, you're going to have access to something that you've earned and paid into your whole life. While most older adults and people with disabilities are still automatically enrolled in Part B, a growing number are not. These individuals must make an active Medicare enrollment choice, taking into consideration specific timelines, complex Medicare rules, which is what we do every day, and their existing coverage. Today, far too many people make mistakes when trying to navigate this confusing system, which is why we are here and we charge no money for our advice and consultation. That's the truth. Today, far too many people make mistakes when trying to navigate this system. The consequences of such missteps are significant and may lead to lifetime penalties. That is a fact. It's very sad too. It's 10% added to your Part B cost, which just went up to $170 for 2022 every month. Unless you're a high income earner, then it can be a lot more than that. But to have 10% of that added on for every 12 months that you went without signing up for Part B when you should have is an unnecessary lifetime burden and tax. And that's what it says here. Far too many people are making mistakes because they're confused by the program, and I understand that. So that could lead to higher out-of-pocket costs and gaps in coverage. In 2020, for example, an estimated, golly, that's horrible, 776,000 people were paying a Part B late enrollment penalty. The average amount increased their monthly premium by nearly a third. That is just horrible because they didn't know what their benefits were and they didn't know the consequence of putting it off. This act would help prevent those costly errors. It would ensure that people approaching Medicare eligibility receive clear and timely information about Medicare Part B enrollment rules. This policy change would advance the goals of the original act as passed by Congress in 2020. So I'm just letting you know this is a very, very good thing that's coming out. And hopefully we'll get finally done where you'll have clear information provided, at least by Medicare, to let you know what your options are. So again, I'll go back to the original part. There are two types of people who ever want to get on a Medicare supplement plan. Those in their open enrollment period, which should be signing up for Medicare and know when those periods are that they should be signing up for Medicare, which is what we can help with. And if you want our help with that, you can go to this link right there, SeniorSavingsNetwork.org, and then do the / thing, open enrollment. Why? Because there's a video explaining what your options are. And then there's a place where you can sign up for a consultation. You can get right on our calendar and not have to play phone tag. You can get on the calendar and see who you're going to be talking to in the office. That's really good. The other part of people who want to get onto a Medicare supplement plan are people who are either going from an old one and want to find out if they can get onto a new one. And again, maybe one of the things you should do is look at your medical records at your provider before you apply for new insurance, including a Medicare supplement. And just know that the insurance companies can, when you sign the application for a new Medicare supplement or a life insurance policy for that matter, they have the ability to go and look at your medical records online. And with these these medical information bureaus, what they do is they just compile diagnosis codes from all over, from your doctor, from hospitals that you've been and all that. And they compile these codes and they see the maximum codes that you've got. So if something's wrong on your record, it will affect your ability to get underwritten. Now, what we're seeing a lot is with inflation, and as I make this is the beginning, the first quarter of 2022, and it's a record time for inflation in the United States right now. And nothing is left unscorched by this inflation. Energy prices, food prices, gas prices, and healthcare prices, all of them are going up. The consumer price index is at a record 40-year high. So what that means is health insurance also is going up because the value of the dollar is going down. Won't get into politics about that. I'll just let you know it's really affecting our seniors on a fixed income more than any other class of people in the country. It really is. What can you do about it? If you're on a Medicare supplement and you've not yet looked at the new options that are out there, and I'm not saying new plans because Medicare supplement plans are rock solid. If you've got a plan G, it's not changing. If you've got a plan N, it's not changing. They're written in the law, they're concrete. What does change is your rate every year. The rate can go up. It never fails that I sit down to do a video and have somebody outside doing blowing, weeding, cutting the lawn, whatever they're doing. It absolutely blows my mind. Just can't get away from it. The point is, so many people out there are spending way too much money right now on their plan. So you can see what they're doing out there. And they don't have to. Where is that guy? I know he's out there somewhere. There he is. Hey, bud. Thanks. Welcome to my video. Welcome. Alrighty then. Blows my mind. It never fails. So the point is, if you're on a Medicare supplement plan and you're already paying too much, you need to look at the market, see what's out there. And I made a real easy way that you can do that. You can see what those options are. I apologize for the background noise. I think somebody's told him that we're on YouTube right now. But if you go to this link, that's right there, underwritten. If you go to SeniorSavingsNetwork.org / underwritten, again, I've got a video explaining how the underwriting process works. And in some states, you don't even have to do underwriting. in Washington State, Oregon, New York, and many others now, Missouri, Illinois, Idaho. A lot of states are adopting these rules where at least once per year, you can change plans without any underwriting whatsoever. But in most states, you have to go through underwriting. And that's what this video explains. It'll show you based on your state where you live, what the rules are, and give you an opportunity to sign up for a time on our calendar where we can look at your rate, ask you some general basic health questions to see if you would qualify. Again, this is why your health record is so important, to see what plans you may qualify for to reduce your cost. We've showed on this channel many times in the past how we save people $80, $100, $120 per month on the same plan that they already have, which means your plan doesn't change. Your deductible, if it's already paid, it's already paid because that's paid at Medicare. Nothing changes at all. Your doctors don't change. Your hospitals don't change. Your freedom to go anywhere doesn't change. There's no interruption in, what's it called? Pre-existing conditions. There are none. If you've had continuous coverage, pre-existing conditions are not a thing. Pre-existing conditions can only raise their ugly head if you've had a 63-day gap in current coverage. If you maintain coverage and there's never a gap, there's never a pre-existing condition that they can impose on you to make you wait a period of time. It's literally end of this month, you end that program. Beginning of next month, you start the new program, and it's completely seamless. The only thing that changes is the amount deducted from your checking account goes down. That's the only thing that's changed. I wrote my first Medicare supplement plan in 1993. That was a long, long time ago. I'll never forget it. It was a United American plan. So my goal since ever getting into this business has been saving people money, getting them on the best possible plan. And this is how we can achieve that for you. And the reason why I make videos like this one, when you go to that page, it'll explain to you the entire process. It'll give you sample health questions. You can see what those questions are. You can see if it's something you may want to approach or not without even talking to anybody in my office. It just explains the process. And if it is something that you think you can qualify for, then you can make an appointment that's convenient for you, and we won't miss the appointment. So it just makes it convenient. You can see what all your options are. Overall, the bottom line is this is good news. It's good news because the direct contracting entity thing that we were concerned about, it looks like it's gone away. At least at the end of 2022, this will be gone away. And the new Accountable Care Organization program, we're going to keep monitoring that. We're going to see what the outcomes are. One of the things that CMS promises in this new program is more transparency. So we can see, is it making people healthier? Are they restricting care? Are they limiting the choices that people actually have? If those things are happening, we'll bring it to you and we'll alert you that you need to pull yourself out of any notice that you may have received that you're in an accountable care organization. Now, is it good or bad to be in one? Only time will tell. This is saying that they've addressed the problems and the discrepancies with the direct contracting entity, with the geo contracting entity. And that was the one where they just lump you into one based on where you live. There are over 50 programs that are currently out there in the DCE model. Those will all be retiring. They can also apply to be part of this new ACO REACH model for 2022. And again, we'll keep you informed as to whether it's a good thing or a bad thing based on your feedback. If you've had any experience in being part of an ACO, please put it in the comments on this video so that others can benefit from your experience. If you have concerns, if you have questions about it, other people may have already been involved and had those same issues. So put it in the comments below. Start a discussion, get involved. So many of you have gotten involved already by reaching out to your members of Congress. I want to applaud you for getting involved. You raised the level of concern such that people got something changed with Medicare. The DCE program is going away, due in large part to activism from people like you and me. Thanks for being involved. Thanks for watching. God bless you. And stay tuned. Make sure you're subscribed for further updates. And please do me a favor, like this video. Appreciate you watching. Thank you so much. Bye-bye.